We begin tonight with breaking news. The FDA has signed off on COVID booster shots for Pfizer vaccine recipients who are over the age of 65, those with underlying health conditions, and people in high-risk jobs. Good evening and thanks for joining us. I'm Marcella Lee. Despite the FDA's move, the boosters are not a done deal just yet. The Centers for Disease Control and Prevention has yet to weigh in on who it believes should get boosters and when. News 8's Abby Alford has more.
While this booster debate gets worked out, in the meantime, people want to know, can they get a booster if they want one? Or do they need a doctor's permission or the FDA or CDC's? President Biden and his administration. Today, the FDA authorized COVID booster shots for Pfizer vaccine recipients for vulnerable people, despite a panel voting against it. In conjunction, the CDC committee is holding a two-day meeting to decide what to recommend about boosters.
The FDA and CDC are not just randomly approving things. They are doing this based on the science and the availability of data. And obviously this might change.
Dr. Argentina Servin is an infectious disease specialist at UC San Diego.
I think even with all of this booster talk, people are wondering, well, if I want to get a booster, it's my body, my choice. Can I go get a booster? No.
We cannot self-prescribe ourselves, and let's not let desperation hit, right? Let's really stay calm.
Now, remember, when we're talking about boosters, we're talking about Pfizer. The FDA and CDC are only reviewing third dose data from Pfizer since it's been fully approved and submitted. New CDC data show that after 4 months, there's a 77% drop in the effectiveness of the Pfizer vaccine against coronavirus.
If one gets authorized does not mean automatically the other ones do as well. They have a separate process.
Dr. Servin says that even if the Pfizer booster is approved, if you originally got J&J or Moderna, you should not mix vaccines.
Please do not mix vaccines. It's kind of like mixing antibiotics for an infection. You're going to create, it's not going to be a good outcome.
Doctors encourage people that despite all of this booster talk, COVID-19 vaccines are effective.
This should serve for reassurance to our community that they don't make these approvals or recommendations lightly.
The FDA advisory panel says that vaccines are working well, that there is no proof that boosters are needed yet except for vulnerable populations.